What role do nerves play in urethral sphincter control? Imagine your bladder as a storage tank that needs to be carefully managed so you can go when the time is right. The control of urine flow depends heavily on a complex network of nerves that act like an intricate communication system. These nerves tell your muscles when to tighten and relax, ensuring you stay dry or releases urine at the appropriate moment. There are two main muscles involved in controlling the urethra, the tube that carries urine out of your body. The first is the internal urethral sphincter, which is made of smooth muscle. This muscle works involuntarily, meaning it automatically responds without you thinking about it. It is kept closed by the sympathetic nerves that come from the middle part of your spinal cord. These nerves send signals that keep the internal sphincter contracted, preventing urine from leaking out when your bladder is filling up. When your bladder is full and you decide to go, parasympathetic nerves from the lower part of your spinal cord send signals to relax this muscle, allowing urine to flow. The second muscle is the external urethral sphincter, which is made of skeletal muscle. This muscle is under voluntary control, so you can decide when to tighten or relax it. It is controlled by the pudendal nerve, which originates from the sacral spinal cord segments. The nerves that control this muscle come from a special area in the spinal cord called Onuf's nucleus. When you want to hold in urine, your brain sends signals to keep this muscle contracted. When you decide to urinate, signals from your brain inhibit the nerve activity, causing the external sphincter to relax and open the urethra. Your brain plays a central role in coordinating these muscles. It receives signals from the bladder and decides whether to hold urine or releases it. The pontine micturition center in the brain helps coordinate the activity of the nerves, controlling both sphincters and the bladder muscles. This coordination allows you to consciously control when to urinate, giving you the ability to delay or initiate the process. During the filling phase, sympathetic nerves keep the internal sphincter tight and the external sphincter voluntarily contracted to maintain continence. When it's time to go, parasympathetic nerves relax the internal sphincter, and your brain signals the external sphincter to relax as well. This combined action opens the urethra, letting urine flow out smoothly. Understanding how nerves control these muscles is especially important in cases of bladder or nerve damage, which can happen after surgeries or due to neurological conditions. For example, in prostate surgery, nerve damage can affect the internal or external sphincter, leading to issues with continence. Preserving nerve pathways during such procedures is crucial to help maintain normal bladder control. In the context of bladder health and bladder cancer, nerve function is vital. Damage to nerves from cancer treatments or surgeries can cause problems like incontinence or urinary retention. That's why medical professionals pay close attention to nerve preservation during procedures involving the bladder or pelvis. In summary, nerves are the messengers that tell your bladder muscles when to tighten and relax. The internal sphincter is controlled automatically by involuntary nerves, while the external sphincter is under your voluntary control through somatic nerves. This delicate neural control system keeps your bladder functioning properly and helps you stay in control of your urination. If nerves are damaged or disrupted, it can lead to significant bladder issues, making understanding this system essential for managing bladder health and conditions like bladder cancer. Always consult healthcare professionals for personalized advice and treatment options.